Good day, Bermuda. This is Dr. Mike with Lighthouse Medical, and this is my first video. In this video, I will show you how to pick the best mask to protect yourself and your family from COVID-19. At the end of this video, you will be able to much better protect yourself and your family against the coronavirus. Let's go. COVID-19 made more than 11 million people around the world sick. More than 500,000 people are now dead as a result. The WHO identified 154 cases in China where the coronavirus caused several dead people to reanimate. The Chinese special forces were able to control the marauding horde of zombies by using drones armed with lasers and depleted uranium ammo. Okay, this didn't actually happen, at least it hasn't been proven yet, but COVID-19 is serious enough even without the zombies. Through social distancing, travel restrictions, and the use of personal protective equipment, or PPE, we have driven the virus back. However, this is not the time to get complacent. The coronavirus is now again on the rise. The second wave is much worse than the first in many places, with the number of cases again growing worldwide. If we're not careful, there will be even more sickness, more hospitalizations, and more fatalities. Personal protective equipment is our armor in the battle against COVID-19. A mask is the most important piece of PPE because it protects the wearer as well as the people next to them. Which mask should you put on, and how well does the mask protect you? From worst to best, here are your 9 choices. Choice number 9. No mask at all. Without a mask, you have zero protection. If you come within 12 feet of someone with COVID-19 and they cough, you will be exposed to the virus by airborne transmission. You will probably inhale the virus, and you will probably get sick. Before you feel any symptoms, you could easily spread the virus to your family members, coworkers, and friends. Almost anything is better than not wearing a mask. You should at least cover your face with a bandana. Choice number 8. Bandana. Although it is better than nothing, it is still bad. Really bad. Scientists at Florida Atlantic University experimented with different non-medical masks to figure out which one was the most effective to help stop the spread of COVID-19. They found that a bandana was the least effective among all mask options. When coughing through a bandana, droplets spread at least 3 feet away from a bandana-covered face. If you want to survive the COVID-19 pandemic, you will have to do better. Choice number 7. A homemade stitched fabric face mask. It is a better option than a bandana. In fact, droplets travel only 2.5 inches from a face covered in this manner. Still, CDC warns that a cloth face covering may not protect the wearer, although it may keep the wearer from spreading the virus to others. Also, a cloth face mask has to be washed regularly, otherwise it may actually increase the risk of COVID-19 transmission. The next best protection, also number 6 on our list, is a disposable retail face mask. These are usually made in China. You can typically find this type of mask in various online and physical stores. These are most often not medical or surgical grade. If you read the label carefully, these masks offer about 65% particle protective performance. This is what they call it, particle protective performance. I don't know what type of particle they're talking about, but 65% does not inspire much confidence. Do you want to breathe in the other 35% that the mask lets through? I don't. Still, these are disposable, which means that if thrown away after use, contaminated masks will not transmit the virus. These masks are, of course, not suitable for healthcare workers because they simply do not offer enough protection. Also, these masks are not tested against the appropriate standard or against any standard. I will talk about this in a minute. Choice number 5, KN95 masks. We hear a lot about these masks lately. These are widely available and are the Chinese version of the US-made N95 mask. However, the quality and performance of the N95 masks are not even close to those of the N95. In fact, recently the Food and Drug Administration banned 65 out of the 80 authorized manufacturers in China from selling masks for medical use. Can you believe that more than 3/4 of manufacturers produced masks that failed testing? How much protection do you think you have from a K95 mask? I personally would like to do better than the K95. By now, you may think that we're all in big trouble, and you're right. Most countries that manufacture medical-grade masks are not exporting them at this time. Still, some medical-grade masks are available and offer better protection against COVID-19. Well, how do we know this? ASTM International, which used to be known as American Society for Testing and Materials, is an international standards organization that publishes the specifications to which masks must perform in order to be considered medical grade. So number 4 on our list, the most basic mask, the most basic medical grade mask, is ASTM level 1, which means low barrier protection. This mask is medical grade and is designed for short procedures and exams that don't involve aerosols, spray, or fluids. It offers 80 millimeters of mercury resistance to penetration by synthetic blood, which is mild fluid resistance. So what this means is that if somebody gets sprayed with a synthetic blood coming out with the pressure of 80 millimeters of mercury, the mask will stop that fluid and it will not get through the mask. This mask also has less than 4 millimeters of water per centimeter square differential pressure. What that means is it's easy to breathe through. The specifications also include greater than 95% bacterial filtration efficiency, which means the mask will stop more than 95% of bacteria that are in the air, and submicron particle filtration efficiency at 0.1 microns of greater than 95%. So tiny particles, which are much smaller than the human hair, will get stopped more than 95% of the time. Did you notice how specific the medical grade requirements are? With the ASTM 1 level mask, you are reasonably well protected against COVID-19. But you can do even better. Number 3 on our list is ASTM level 2 mask, which offers moderate barrier protection. It handles up to 120 millimeters of mercury resistance to penetration by synthetic blood, which is better, significantly better than ASTM 1 level. And it's still fairly easy to breathe through with less than 5 millimeters of water per square centimeter differential pressure. Its bacterial filtration efficiency and submicron particle filtration efficiency at 0.1 micron are even better than ASTM 1. They are now 98% for level 2 instead of 95% for level 1. Your chances of infection with the coronavirus are fairly low if you have and properly wear this type of mask. Number 2 on our list is an even stronger mask, ASTM level 3. It has even better barrier protection with 160 millimeters of mercury resistance to penetration by synthetic blood, and has the same breathability and filtration efficiency as the ASTM level 2 mask. Your chances of catching COVID-19 are fairly low if you haven't properly wear this type of mask. So you may feel pretty good right now about your safety. Maybe you even have a few procedure masks or surgical masks hidden in your drawer. So all is well, right? Well, no. Here's the secret that nobody is going to tell you. Procedure and surgical masks are loose-fitting. They do not have a fit testing requirement. They do not have a seal check requirement. When you breathe through such a mask, leakage occurs around the edge of the mask. This means that the virus could sneak in around the mask and still infect you. But is there anything better available for us to wear? choice number 1 on our list, the best choice, is an N95 mask. They're usually fluid resistant, but their main focus is to reduce our exposure to particles. N95 masks have a very high filtration efficiency for small particles. Because an N95 mask is tight-fitting and is designed to form a seal around the face, the coronavirus cannot get into your lungs by leaking around the mask. Leakage control is the big advantage of the N95 mask. The problem is that at the time of this recording, N95 masks are hard to get, and some people may find them difficult to breathe in. To sum everything up, first, during the COVID-19 pandemic, always wear some facial covering to protect yourself and others from the virus. Second, if you can, get a proper medical-grade mask. And finally, please like and share this video if you enjoyed the content and would like to see more. Until next time, this was Dr. Mike with Lighthouse Medical. By the way, my contact info is in the description. Please feel free to send me an email. Until next time.